This treatment will focus on accentuation of the male face. We have a young patient who's 22 years old. Our goals for this treatment are going to be to accentuate the patient's positive features, which are to work with and accentuate his nice bizygomatic distance, his bigonal angle, and width to the chin. We can see certain areas of the face that can use enhancement by creating a more masculine look to the face. Particularly, our focus will be looking at the mid-face area where we see a lot of flattening everywhere from the infraorbital to the mid-cheek region. When we look at the face on lateral view, we can see that the nose is also under-projected and over-rotated with a very deep radix that starts a little bit low for the patient. We will be augmenting the chin in a more anterior projection, as well as adding volume to the mid-face and the lateral portion of the zygoma. Our treatment plan for the cheek will include augmentation of the zygoma in a horizontal direction. Whereas in a female cheek, we want more of a vertically inclined height to the cheek. In a male, we would like more of a horizontal strength, roughly parallel to the area of the tragus. We will be using Radiesse in this area to create nice angular volumetric expansion without creating a softer or pillowy look to the cheeks. In the area of the mid-cheek, we will be using Belotero Volume. In the chin, we will also be using Radiesse. And in the nose, we will be augmenting using Belotero Volume as well as Belotero Balance to try and create the look of a longer and stronger nose for this patient. Our treatment points for injection for bolus injection are marked out along the zygomatic arch and along the malar eminence. In the male cheek, we prefer an anteromedial augmentation rather than a more high and lateral augmentation. Thus, a point will be chosen just medial to the malar eminence for maximal augmentation. Our initial injection point is right over the zygoma. We inject right on a pre-periosteal plane, injecting approximately 0.1 to 0.3 cc's per bolus injection. For this initial point, we have injected 0.2 cc's in bolus fashion. Our second injection point, which was our anterior cheek point, is also injected in bolus fashion. The skin is retracted, and 0.25 cc's will be injected at this point. A cannula is used in this region in order to minimize the chance of injury to the angular artery and infraorbital nerve and artery. After I inject it, I massage a little bit, as you can feel, to make sure the product's blended in there and smooth. So this case highlights treatment of the male cheek, which involved treatment of the zygomatic region, maxillary region, and also medial maxillary region with a combination of Radiesse filler to the lateral cheek and Belotero Volume to the mid-face, along again the medial portion and more lateral portion of the maxilla. We've created better support for the infraorbital region and eliminated the hollowing, as well as reduced the length of the lid cheek junction. Strength in the zygomatic region has been created in a horizontal fashion, which emphasizes the masculine features of the face. Next, the infraorbital area will be treated by a lower G' filler such as Belotero Balance. Small amounts of filler will be treated right in the infraorbital hollow. Treatment proceeds from a medial to lateral direction. 0.25 cc's were used on the right side, and a similar amount will be used on the contralateral side. Next, we'll be using Radiesse to augment chin proportion, particularly in an anterior-posterior dimension. We're using Radiesse, which is calcium hydroxyapatite, for this purpose. The injection is injected right on a pre-periosteal plane again. Typically, patients will feel some discomfort and a tightness due to the adherent fibers of the mentalis muscle in this region. Next, we'll be performing treatment of the nose in order to create a slightly more masculine, longer, and counter-rotated version of the nose. Extreme care must be taken when injecting hyaluronic acid into the nose, and knowledge of the arterial supply is mandatory. The nose is supplied by branches of the internal carotid system, the paired dorsal nasal arteries, as well as branches from the infraorbital system and facial artery system, including the angular artery. The lateral nasal artery is the primary blood supply to the tip and branches off the angular artery and courses in an area roughly corresponding to the alar groove. Inferiorly, branches from the superior labial artery, including the columellar artery and septal artery, innervate the tip of the nose. There are also branches from the anterior branch of the ethmoid artery, which give blood supply to the external skin. These are all rough landmarks, but in reality there are multiple anastomotic vessels and multiple branches of each of these vessels. Our injection should take place in a plane that is as safe as possible, which is right overlying the periosteum or right overlying the cartilage and not in the soft tissue itself. Aesthetically, we would like the nose to start at a higher point, roughly equivalent to the level of the supratarsal fold or upper lash line. In this case, we can see that the glabella is deep and the starting point or radix of the nose is low. We will build the bridge up and then following that try and increase definition and reduce the apparent rotation of the nose. In the male nose, we would like to see more of a 90-degree angle between the lip and the nasal tip. Our initial injection is at the radix of the nose, deep down on an immediate pre-periosteal plane. The thumb and forefinger are used to prevent lateral migration of the filler, and the injection takes place on an immediate pre-periosteal plane. The injection is centered centrally on the nose and care is taken not to inject laterally. Next, we'll be using a lower G' filler, such as Belotero Balance, to try and inject the infratip region. The plane of injection is just overlying the cartilages of the lower portion of the nose, or the lower lateral cartilages. The injection is carried out in very small volumes with very low pressure. Care is taken not to inject between the domes to create divergence or widening of the tip. Further injection is carried out in the infratip region in order to create the illusion of counter rotation. Treatment of the nose now shows higher nasal bridge and increased tip definition with the illusion of tip counter rotation. The result is a more masculine appearing nose with higher bridge and contour and more angularity on front view. After completion of the treatment, immediately post-treatment, the cheeks and infraorbital area are slightly swollen, as is the chin, but highlight has occurred in the cheek area in a horizontal fashion, augmentation of the midface, softening of the periorbital area, as well as strengthening of the chin and nose.